Welcome. Let's talk about medicinal treatment of anal fissure. Anal fissure is a small tear or crack in the skin around the anus. It can be painful, especially during or after bowel movements, and might cause bleeding. Common symptoms of anal fissure: pain during or after bowel movements, bright red blood on the toilet paper or in the stool, itching or irritation around the anus, visible crack or tear near the anus. Most cases of the anal fissure heal spontaneously within a few weeks without requiring treatments. Chronic anal fissure that persists even after 2 months. 10 to 30% of chronic fissures will eventually resolve with conservative treatments. Multiple fissure or fissure in a lateral position of anal margin may indicate inflammatory bowel disease or syphilis or immunosuppression. Newly healed skin is likely to be weaker, therefore may easily recurrence, particularly if the cause of fissure is not adequately treated. Reason behind the fissure: hard stool or constipation. It's mainly depend upon dietary factors. Next one, diarrhea. Next one, trauma, anal intercourse or after childbirth, poor blood flow, internal anal sphincter hypertonia. Treatments of anal fissure. Treatments of acute fissure: 90% of acute anal fissure heal spontaneously with high fiber diet and stool softeners. Fibolox is a high fiber drink. It prevents bowel constipation, diarrhea, and irritable bowel syndrome. Increasing the intake of dietary fiber by consuming more fruit, vegetables, and whole grains with fiber supplement if necessary. Staying hydrated by drinking sufficient water. This helps the skin in the area to develop strength and prevent a recurrence of anal fissures. Next one, warm Sitz bath. Pain of passing stools may be greatly alleviated by soaking the region by sitting in a warm Sitz bath regularly, like 2-3 times a day, so that the warmth can relax the anal sphincter muscle. It is the procedure of Sitz bath. Clean the hab, fill with warm water or lukewarm water, and add Epsom salt, or you can use salt or normal saline, and sit in the tube about 10 minutes, then pat dry with soft towel. I will do another video about Sitz bath procedure. Laxatives. Laxative which increase the volume and softness of the stools. They help to soften the stools and to encourage the regular passage of stools. Syrup like Cremafin Plus and milk of magnesia. It is used 15 ml at night for stool softening. They can prevent the constipation that may cause anal fissure. Use mild laxative regularly for few weeks to allow the fissure to heal. Next medicine is glycerol trinitrate ointment. It may be applied to the anus to expand the blood vessels and increase blood flow, which encourages healing of the fissure. Avoiding products containing fragrance or alcohol that will come contact with the anus. avoiding medication which cause constipation. Next one, treatments of chronic fissure. Glyceryl nitrite cream also used in chronic fissure also. Glyceryl trinate cream 2 times for 8 weeks. It is first line treatment, but some patients may experience headache. You can use glyceryl trinitrate suppository also, same like 2 times for 8 weeks. Next one, diltiazem cream. Its brand name is Crema Gel. This cream applied 2 times for 6 weeks. It considered as a second line treatment for those not responding to nitrates. Diltiazem hydrochloride is a calcium channel blocker. It is directly applied topically to the anus to relax the sphincter muscles and increase the blood supply to the region. Next one, sucral ano cream. It contains sucralfate 7%, lignocaine 4%, and metronidazole 1%. Why sucralfate and metronidazole in the treatment of anal fissure? Sucralfate helps to promote healing of fissure by forming protective layer over the wound. It preventing it from further mechanical injury during bowel movements. Next one, metronidazole is an antibiotic that is effective against anaerobic bacteria which are commonly found in the gastrointestinal tract and can contribute to infection around the anal region. Next one, nifedipine topical cream or oral tablets. Nifedipine topical cream 2% 2 times per day. Other choice is nifedipine tablet 20 mg orally 2 times per day. Why nifedipine? Nifedipine is a calcium channel blocker that helps to relax smooth muscle tissues. It helps to relax anal sphincter muscles and improve blood flow to the area, which is essential for healing. High blood flow to the area, it will bring oxygen and nutrients, promoting the repair of damaged tissues. Topical anesthetic gel may be applied to the anus to numb the area before passing the stools to reduce pain. Steroid cream applied to the area may reduce the both severe swelling and itching. It helps the patient become more comfortable. This should not use more than 1 week. Ornidine ointment. It contains ornidazole and povidone. Apply locally for 1 to 2 weeks. This combination also used for anal fissures, infections or rectal inflammations. Next one, stool softeners. Stool softeners is very important in case of hemorrhoids and anal fissures. It is used in acute case and also chronic case. Cremafin plus or day's milk of magnesia, it is used 15 ml at night. It is important for further incidence prevention. Next one, botulinum toxin injection. Botulinum toxin injections are useful to paralyze the sphincter muscles and prevent muscle spasm to improve healing. Why Botox injection not used commonly? Botox provide temporary relief, typically lasting 3 to 6 months. Botox injection can be expensive, especially if multiple treatments are needed to over time. Anal incontinence. Some persons may experience difficulty controlling bowel movements or leakage. It is the one of the important side effect of Botox injection. Surgery. Most patients will not require surgery for anal fissure. It is recommended for chronic cases when other methods have failed to bring about the healing. Thank you for watching.